Well, love is in the air on Valentine's Day, though for some people, love can be a sore subject. Many of us have experienced the emotional pain that comes with heartbreak, but for some, that pain can lead to a serious medical condition called the broken heart syndrome. News 4's Angela Cristoforos met a Western New York woman who felt the effects firsthand. Angela?
Jackie, dying of a broken heart is something we've all heard of. You may recall in late December, actress Debbie Reynolds passed away one day after her daughter, Carrie Fisher. It isn't just a figure of speech. You actually can die of heartbreak, and the condition can strike people who are completely healthy. When Melanie Gromick thinks back to her favorite memories of her big sister, Florence, it's the little things that come to mind.
She was just a good friend, did a lot of things together. Christmas baking was always together, and we just got along well. We understood each other.
They had a 16-year age difference, but a very strong sisterly bond.
She was just there when I needed her, and she would call every week to see how you're doing.
In 2010, Melanie's sister Florence suddenly passed away.
It was just a surprise. It was a shock, actually. Something you didn't expect to happen.
The next morning, Melanie said something felt off.
My stomach just felt uneasy. It wasn't a pain, it wasn't pressure, it was just, didn't feel right. And my chest just, a peculiar feeling, which I've never had before.
She presented with chest pain, shortness of breath. Her EKGs and blood work, everything were pointing towards like she was having a real heart attack.
Dr. Mohan says unlike most patients who have a heart attack, Melanie didn't have any major blockages in her arteries.
We treated her, she got out of the hospital, and when I reassessed her heart again in a few weeks, her heart function came back to normal. And that is when you make the diagnosis, this is broken heart syndrome.
Takotsubo cardiomyopathy, known as the broken heart syndrome, is caused by a sudden emotional stress trigger, but the symptoms, like Melanie's, can be subtle.
He said, "You've had a heart attack." I've had a heart attack. I didn't have any true symptoms. I mean, I wasn't having trouble breathing.
Dr. Mohan says the condition is not very common. In Western New York, he sees 1 or 2 patients with broken heart syndrome a year. He says it's most common in females ages 60 and up.
Fortunately, based on the recent data, in about 4 to 10% of the patient, it can reoccur. We still don't understand why.
It's been nearly 7 years since Melanie's sister Florence passed away. Some of the emotional pain has faded, but Melanie still meets with Dr. Mohan to have her heart function monitored every 4 to 6 months.
After the death of a close loved one, don't disregard some symptoms, because this would have been very easy for me to disregard. And what kept me motivated, I don't know.
Now, a side note, after her sister Florence passed away, her husband, who she was with for more than 60 years, said that life just wasn't worth living, and he passed away too about a month later.
The sister's husband passed away.
The sister's husband.
Wow.
Isn't that something?